Um, what I want to do is to begin the presentation proper by just referring to what's called what some researchers have actually called disenfranchised group. So, and you may be asking, what's this got to do with grief in the context of cancer? Well, I think as a society, we generally associate grief with death and death of a person, particularly a loved one. And this kind of is probably reinforced by healthcare providers. And generally speaking, the public doesn't acknowledge other kinds of various losses. So the term disenfranchised grief refers to the kind of grief that is overlooked by virtue of it not meeting the threshold of the loss of a specific person. And therefore, that such a loss is not worth mourning. In essence, it remains invisible and hidden behind the general experience of navigating through the expected challenges of treatment and illness. The unwanted changes and losses are kind of invisibilized, if you like. However, over the last maybe 20 years or so, grief theorists have recognized that there is a grief associated with functional losses and almost kind of existential losses through particularly ill health and its treatment. And so that brings us to the focus at hand about, and what we're kind of concentrating on this morning is losses specifically associated with having a cancer diagnosis and the kinds of griefs that can really emerge from those particular kinds of losses, which have traditionally been sort of invisibilized. Um, so, moving on to the second slide. So these are sort of cancer-specific considerations when we're thinking about the idea of grief in the context of cancer. Now, cancer, of course, is a huge time of change. So some of the sources of grief as a result of the cancer experience can be that associated with physical losses. It might actually be the loss of a body part. So in the cases of where there's a mastectomy or if someone has testes removed, those are instances of severe loss. It might be the loss of your hair or the loss of a physical feeling like that of being yourself. You might look different or seem different. And seeing those changes in yourself, whether it's in the mirror or in interactions with others, these can definitely generate a lot of feelings of grief. For younger people, especially that go through treatment, the loss of fertility is a particularly challenging experience. So, because the likelihood of having children is significantly reduced. So that's obviously going to provoke all kinds of psychological and emotional issues. For some people, the loss of sexual appetite is also problematic because it can really disrupt the sense of connection that you might have with somebody, particularly your spouse, and disrupt the sense of who you are prior to illness. So when we think about the sense of self, you might be grieving over the changes arising from the role within one's family. So, for instance, if you're a mother of, or a father, for that matter, of adult children, and suddenly your adult children are taking care of you, and that happens quite a lot in cancer, that can bring with it a lot of grief because those sorts of natural transitions are meant to happen over the course of a lifetime. And with cancer, they can happen virtually overnight. And so the shock and the change that's associated with that can really change, really sort of introduce quite a lot of distress and fundamentally grief because something has radically changed. Disruptions and changes in your relationship with your friend circle or how your role in the family is worked out can provoke problems because your former role as a caretaker or provider may well have to change radically. And you may have to take time off of work or come away from career in order to meet the challenges of illness and its treatment. So I think as well, it's also worth thinking about the kinds of existential losses that people can experience as a result of cancer. In one conversation with a patient, they said they had a kind of a movie about how their life would work out. And then suddenly there's this really eruptive, sudden disruption. And then there's a change in how you feel the rest of your life will actually look. And that's, into next month, next year and beyond. And that's not something you can just be able to cope with overnight. And so it's a really important thing to remember in coping with grief associated with these unwanted changes, that it's not linear. I think the expectation of a lot of folks that have loss, a death-related loss or a loss such as these, is that they have the expectation that they're expected to kind of get on with it and it'll be okay. But the reality is that grief is not linear, and that these issues can ebb and flow and repeat almost like in a tidal fashion. It just makes sense that that actually these things will interrupt your specific dreams or goals, and maybe a sense of the loss of a certain kind of future, and that these feelings, these experiences can't help but generate a great deal of grief and confusion. Suddenly you find yourself thinking differently about your life, and thinking differently about your future, and that can trigger a lot of grief feelings. So I'm thinking about the next slide, and we're moving to maybe when we're thinking about grief, are there certain kinds of grief? Well, the answer, plain and simple, is yes. There are different types of grief. So I've listed four types. There are others in some literature that actually says there are about 16, but I'm just going to concentrate on four that are relevant to our talk this morning. So the first type of grief is kind of reactive grief. So when we're thinking about the sort of reactive grief, is that it is what it suggests. It's a grief loss that occurs in relation to a fairly immediate circumstance. If you go to the Donegal Cancer Care West Facebook site, you'll note that we've put on a podcast there, which is an interview I held with someone, with a patient. And in the interview, she's talking about hair loss, and she talks about the shock of it, because in the event she actually had her hair shaved off. But she does talk about the shock of actually having to do that. And it is the reality that it is quite an upheaval to have such an immediate thing to have happened to you, and the natural sequelae of that, the natural kind of fallout of that is that you are going to potentially have a kind of an adversive reactive a grief reaction to that, that something that you don't want to change is having to change, and it's pretty quickly. So that's the idea of reactive grief. So the second type of grief is called cumulative grief. And this happens when someone has experienced a second or even a third or a fourth loss in very close succession. And the feature of this is that there is no psychological space for adaptation or recovery or recuperation.
Ain't
Because
my first time at the rodeo. But my
so there's no sort of space to be able to recoup and recover from sets of unwanted changes, and that can almost feel like it's too much to bear, and it can lead to a sense of really feeling unequal to meet the ongoing challenges. It can really undermine a sense of confidence and capacity to move forward, or even to endure what might lay ahead. Some people make the statement, I just can't do it anymore." So that's a cumulative grief. And then we come to secondary losses. So these occur when kind of losses incur changes in other areas of your life, um, and these are losses stem from a significant change in one area of your life, of your experience. So, so
I have to charge my phone too.
hello,
No,
hello, just to ask the person there that's charging their phone, can you turn your mic off a little bit, please? That'd be really good, if you can do that, because we're getting cross contamination with the audit. Thank you very much indeed for doing that. So that's secondary loss. They're losses which occur sort of associated with the primary loss, and it can really affect other areas of your life. And typically, the typical one is actually jobs. So when people are actually under sort of treatment and they have to stop work for a variety of reasons. So a secondary loss could be that of financial, particularly. It has the primary change is that of treatment, but it has a ripple effect in material ways into other domains of one's life. And so the other kind of loss is maybe something that you've maybe heard of before, and that's called anticipatory grief. So in anticipatory grief, it's often described as a kind of a roller coaster of emotions, and you might not have heard of the term anticipatory grief, and this refers to the distress that you feel in the present moment in advance of an impending loss. So one of the difficult things about cancer is that it can be ambiguous. It can be an ambiguous loss because you don't really know what the future holds. And because of that uncertainty, coupled with the knowledge that a radical change lies ahead, this can introduce grief that is in anticipation in the sense of a significant and unwanted change that is going to be imminent at some point. So if we're looking out for anticipatory grief, what are the kinds of things we could kind of look out for? So it's often described as a kind of a roller coaster of emotions or a lot of conflicting emotions. So whether it's yourself as a family member or a patient, our emotions can range in so many different ways. When we're going through a loss or anticipating a loss, the emotions can range from sadness to feeling cross to feeling frustrated. Sometimes the emotions go up and down. If you're a loved one supporting a patient, you might notice that some days that you're in a good mood and feeling relatively at peace with themselves, and then the next day they're not at all. They're feeling much more agitated and but that's the natural kind of ebb and flow of these things. Sometimes people will have sleep disturbance, and this can be really impacted as well. And as well as that, our eating habits can radically change. There's usually as well a lot of fear and anxiety around the future, and that's a very, very common expression that people will talk to me about. And I think as adults, we experience an impending change associated with something big happening in our life. We can have issues with concentration and focus. And this again is something that I hear quite a lot of. Clients would say that they just can't focus and they're thinking about this loss or that loss or an upcoming change. And that's really hard because on the one hand, we want to be able to kind of keep doing the kind of day-to-day ordinary kind of things of life. But then that's kind of impeded by this anticipation of something quite negative or quite challenging that's actually going to be unavoidable, and we have to kind of endure it. And lastly, I think some people will sort of, in the cases of where we're actually looking after somebody who may be terminally ill and at the end of life or facing the end of life, Some people will rehearse the death experience. We might often imagine what that loss is going to be like without that person. In the case where you have someone in your life with a terminal diagnosis, you might rehearse or think through what the day would be like when they finally pass away. And obviously, it goes without saying that that can be a really troubling experience. So these are just a handful of some of the signs that are commonly associated with anticipatory grief. And it's the case that people will have some or maybe all of the above. One thing to keep in mind is that everybody's experience is unique, and people have different personalities and temperaments, and they also have different ways of expressing themselves. So it's important to keep in mind, if you're supporting someone or even for yourself, to remember that there's no right way or wrong way to show anticipatory grief, or in fact any of the other kinds of grief that we've talked about earlier. Grief is a normal emotion. It's a profound emotion we feel when we've lost something or about to lose something, or when we anticipate lose something. Grief is characterized by sadness, anger, frustration, irritability, changes in appetites, changes in your sense of self. So grief is actually not just a kind of in the head kind of thing. It's actually a whole body experience. And you may find that you might need more support than you've ever needed before. Um, so that brings us to why is important to talk about this? Why is it important to talk about these kinds of losses? Well, I think one of the most important things to consider is that, in some respects, denying one's own experience, dismissing the reality of what you feel in the case of losses, is a kind of an act of self-disrespect. You're denying and dismissing what you're going through. And whilst it might seem like the best thing to do in the short term, over the longer period of time, that sense of grief and sadness may well build. Look at it like this. If you were charged with the care of someone close to you, and they were being asked by some outside party to dismiss their emotions associated with loss, you wouldn't feel that that's the right thing to do, would you? It would be actually disrespectful to ask that person to dismiss their losses. And then, so, in the same way, if you follow the logic, it's also self disrespectful to dismiss our own losses. And it's really important to acknowledge how much of a challenge those losses have introduced. It's also the case that when we discuss these issues, we reduce the sense of, or we reduce the risk of isolation, I should say. And it's very true to say that when we have a problem shared, it's a problem halved. If we don't think about our grief, it's actually likely to get bigger through neglect. So just being able to put a name on that grief can help us get into a position of being more able to manage it. Left unchecked, it could actually show up in different ways and make us not really be like ourselves or act like ourselves, and in fact become someone who is irritable or and closed in on themselves. And in the end of that, it means that we kind of disconnect from those whom we love, and maybe going on to disconnect from the things that we actually need in order to kind of keep going to meet the challenge of getting through treatment. And that's not at all a good thing. So if we do engage in talking about it, if we do kind of buy into the idea that it's an important loss to talk about, it certainly reduces the risk of grief escalating. So the final kind of slide is about management. So given that we're thinking about grief, and it is an experience that we might have, well, what can we do about it? Well, these are some of the ideas that are out there in terms of managing grief. Well, and one, the first thing speaks for itself. It's actually acknowledging. It's acknowledging that this loss, this change, this unwanted feature in my life, this unwantedness is getting under my skin. And actually that maybe leads us to think about, connecting with somebody, or maybe even a group of people who can really listen in and tune into what you're experiencing. That's not there. There are all kinds of people in our life. Some people are able to make us laugh, and some people are really able to listen and engage with us. And I think it's really about having the balance of both, being able to have those two elements in our life. People able to hear what we have to say and endure with us our losses. Connecting with kind of life-giving environments. I find, as well as many others, that actually getting out into life-giving environments, nature, the sea, those kind of places often really help people kind of feel quite grounded. And as well as that, movement, walking. I won't say exercise because not all people will can engage with that idea, but certainly movement, be that kind of dance, anything from dance to walking on the beach to those kinds of things are really sort of helpful for people. Support groups. We have a number of support groups here in Cancer Care West. We are introducing them all of the time, and those are often places where people can really feel that they're being held and being acknowledged, which again reduces the sense of isolation, which is an important kind of thing to ameliorate against grief escalating into something which in the long term becomes unmanageable and gives risk to things like depression. So that connecting with capacities, like we sometimes because of illness, we almost forget the person that we were. We forget we were a reader or a musician or an artist or a painter or whatever it is that kind of floats our passions. So an important thing to do is to, whilst we have deficits in our lives, and often they are imposed deficits, it's important to think, well, how can we connect with capacities? So we get into that idea of sort of reconnecting with our older self. Be very mindful of what your mind consumes, especially in things like social media. There's a lot out there. There's a lot of information out there, and some of it is very helpful. But it's also very true to say that some of it is very unhelpful and can take our minds into really unhelpful places. And the last thing is balance in friendship. Balance the friends that whom you can talk with those whom you can laugh with and engage with. So those are some of the kind of top tips in terms of thinking about managing grief in all its many formats in relation to grief in the cancer context.